Hey, Diet Coke, sponsor us. This is not a paid advertisement.
It's not. I have to buy this, and it's like friggin' $1 a
It's
can.
more than wine. We talked about that on Easter. Jesse's grandpa, 80 something years old, does 300 push ups a day and like drinks 2 glasses of wine. That's his secret.
Well, whatever.
All right. What episode is this?
I don't know what episode this
Episode
is.
5 or 4. But we've forgotten to do an introduction.
Good morning, everyone. My name is Julie. I work at the Arthritis Center. I am the practice manager and the bathroom monitor.
Today I am Claudia. I am miscellaneous. I am Julie's assistant and patient advocate.
Yep. So we do it all.
We joke a lot.
We joke a lot because you're either going to laugh or cry, and I choose to laugh instead of crying.
I cry a lot.
She does cry, but she's young. That's what some young girls cry. Okay, so in the office, this is like sort of a day in the life of a rheumatologist office. But in this office, I am in charge of the patient experience, and Dr. Bach and the clinical team are in charge of the patient outcomes. So in the patient experience realm is where she and I primarily
I do our social media, so all of the negative reviews people leave,
she gets to deal with that. So anyway, I have really renewed energy today because I had a couple of cases get flipped. And when I mean a case getting flipped is when you have a patient that you're working with trying to get them on a certain medicine, and the insurance company or the PBM just keeps deny. When I finally get an approval, it literally is like massive wind in my sail.
What does the insurance company benefit from denying?
Well, then they can increase their profits. I mean, the more they deny, the more money they get to keep. And it's super, super shitty. So everybody's a patient. I'm a patient too. Everybody that has insurance is paying premiums. Either you're paying it from out of your paycheck, which is what we do here, and our employer, which it happens to be me, we match all the employees, and we pay 50% of their premium. So I'm in it to win it here. I am paying top freaking dollar for my staff to have insurance. But if you need to use it, guess what? Get your wallet out again because you're going to pay more.
She experienced it firsthand.
Yeah, I had a surgery on February 26th, an L5S1 microdiscectomy. Do you know that they told me to bring a check for $3,000 to the surgery, and if I didn't, they weren't going to be operating on me?
I'd have to ask if they had dishes in the back for me to do.
I mean, luckily I can borrow money and write a check for $3,000, but most people can't. Like this, not only am I paying an enormous amount of my paycheck to Anthem or Evolence or whatever you guys are calling it today, I'm also having to pay the first, I don't know, is it $3,500 or $6,800? The first $3,500. And guess what? I've already done that. Oh, and now that stupid MRI place said we didn't pay.
Yeah, I need to call them.
I don't know. Healthcare is a dumpster fire. Okay, but let's talk about the wins. All right.
So yeah, we have had 3 instances so far. I think we should start with the one pending right now.
Okay, the one that isn't approved.
Right.
Okay, so the one that isn't approved is a patient that her husband is in a laborers union. And
and you guys know how unions stick together.
Right. So her husband is a laborer, and she's been our patient for a while. So she actually has her insurance, which happens to be Meritain, which is owned by Aetna. Hi, Aetna, call me. They have been denying her since July of 2023. This is such a pitiful case. So now that the patient has filed a formal complaint with the Department of Labor, that would be the DOL.gov. Okay, that is not an email anybody wants to get. But guess what? Meritain got one. So I would like to, the patient forwarded me this email because I've been very actively involved in helping her advocate. But I wanted just to read a little bit about what her complaint, where we're at now with it. So the patient filed the complaint on 3/21/2024.
Because the doctor's appeal is trash. Basically means nothing.
Yeah. So here's the dealio. If a physician's office has an appeal, the insurance company and the PBM, they don't have to respond to it. And guess what? They don't. A lot of times they just tell us we didn't get the records. Well, that's all bullshit because they do have the records. They just don't have them handy for the agent in Philippines or in India that is on the phone with us, the doctor's office, and just wasting our time. But this is really exciting stuff because the patient appeal carries way more weight than the physician appeal. So I think that we're going to start pivoting to this more and more, because instead of this being step 12 of a patient complaint, it needs to be step 2. As soon as we get the denial, I'm going to have to start engaging these patients and saying, look, I already know how this story ends. I've written this book, and if you want to have if you want to change the ending, then you need to file the complaint.
Well, and it took longer than we thought, but it still was quicker than we get a response from any insurance
company.
Oh,
for sure. So this patient filed this complaint on March 21st, and on March 25th, the Department of Labor is running up Maritane's rear end with a colonoscopy, looking for information. Okay, so just for the people in the back, all right, the U.S. Department of Labor Employee Benefits Security Admission, which is EBSA. What's that?
Okay.
Okay, EBSA. So this lady is from the Department of Labor, says she is intending to protect the benefits of workers and retirees in the private sector pension and welfare benefits plan. In general, EBSA, which is the Employee Benefits Security Administration's responsibility, is to administer the fiduciary reporting and disclosure provisions of ERISA.
Fiduciary means?
Fiduciary means that I am spending the money in the right places, and I'm doing right by the patients. So guess who's not doing right by the patients? I think it's this insurance company, but stay tuned. So she continues, the Department of Labor continues to write. I spoke extensively with the patient's name, which we're going to call her Jennifer, and her rheumatologist practice manager, Julie. That would be me. I love that I'm in the letter. Regarding Maritane's abrupt denial of fill in the blank patient names Actemra infusion administered every 4 weeks. To my knowledge, neither the beneficiary nor the provider has received an official response from Maritane after they filed appeals to the denial of the Actemra infusion. True story. Because
why is this bad?
Because they have the fiduciary responsibility to do right by the patients, and they're not doing it. So I would have my day ruined if I was Maritane getting this letter. She's like, this is from the Department of Labor. Please provide the following information and documentation. Number 1, please send me a SPD. For those in the back, I actually didn't know what that meant either. Summary plan description. Number 2, please provide any written correspondence, including appeals, between the plan and this patient and Dr. Rock. Number 3, please provide a timeline and explanation for why this denial has been ongoing since July of 2023. Number 3 should be enough for this plan to say, you know what, give this patient what she needs. We don't want to deal with you guys.
I'm so sorry.
Because they are in hot freaking water. Okay. And then number 4, if the plan upholds the denial of the Actemra infusion, please provide detailed explanation of the denial, including any medical guidelines and plan provisions that were used to render the denial.
The AI.
Right. The AI, the agents in India or the Philippines that have goats bleeding. Bleed, bleed. That's the sound a goat makes in the background.
That's what I heard when I was in Czech. It sounds like
really
screaming. Yeah.
Okay. Well, whatever. Those are the goats have more physician on the phone time than the people.
We know how to mimic a goat better than the representatives.
I'm like, hey, I've got your name for my chart. What's your goat's name? Does your goat have a name? Okay.
Are you taking suggestions?
Anyway, so I'm super excited about this because I think this case is going to get overturned.
We had a really scary case come in too.
Oh, the IVIG case?
Yeah.
Okay, so we have a patient that's an IVIG patient. He is
so handsome.
Really?
No,
I thought you were talking about your boyfriend now.
Oh, God.
Okay, she's like in love too. So anyway, this patient has CIDP, and it's chronic inflammatory demyelization. I think it's like paralysis. Don't look it up. We don't want to waste
I called it
time.
COPD. It's
not
that.
COPD. It's CIDP.
Google it, please.
At any rate,
We just argue.
The treatment for this disease, which is super devastating. You can go from walking normally to all of a sudden you can't raise your legs up.
Our first podcast episode
talked about that. Oh, yeah. That was with our friend Dorothea. This patient is not her. This is another one, but he has a reoccurrence, so he needs IVIG. And guess what? Anthem, Elvolence, whatever they are, they've managed to continue to deny it. Except, I spent 2 hours and 12 minutes on the phone with the patient and Anthem, Elvolence in the Philippines.
This is a phone call you could not pay me to be on the other side of. I would not accept it. I would.
Well, they got to make their 30 cents on the.
I would be like, no, I can't take this one. They're going to make me cry.
Listen, if you want to cry, cry. But this patient needs help. And this morning when I got to the office, what do you know? Anthem, Elvolence has managed to find it in their hearts to approve this patient. And it's a damn good thing because I was going to send him as a direct admit through the ER and let him get an infusion there to the tune of probably $100,000.
Well, how hard of a time did you have getting him approved the first time?
Well, I didn't get him approved the first time because Anthem was, I don't even know if he had Anthem. He was covered under someone else. But the first time, we did do a direct admit through the ER, and he had to stay in the hospital 5 days.
Did he have to get a lumbar puncture there?
Yes, he did.
What's that feel like?
Well, it's called an LP in the industries, lumbar puncture. I'm sure it hurts, but they want spinal fluid. And, Dorothea had that too. Well, not if you wanted to not have it done twice. I think
I'd like to die.
You don't want to die. You don't want to die. But so we've got a couple of back-to-back wins. And we also have a patient in here.
Boris was here. Remember, he was helping us work on. We introduced everyone.
Yeah. So Boris did 2 cases with us, and one of the cases that Boris helped us get overturned, our friend John is here, and he's getting infused, and he's been delayed and denied since November of 2023. And he's a corrections officer, super cool guy. And he came up to me this morning and he put his arms around me and said, "Thank you for what you do." And that is like, I don't know.
There's nothing else like it.
I get weepy.
You get defeated. It gets almost like you're just fighting against a wall. Like you're not getting any response. You're not getting any up. You're not getting any down. It's just like you're fighting with a wall day in and day out. So once you finally get an approval, and then it's let alone acknowledgement from the person that you helped get the approval from, it's a reminder as to why we do what we do.
It's super heartfelt because if we weren't doing this advocacy piece, these patients would not be getting treatment. I mean, these insurance companies and PBMs, they want nothing to do with us.
Well, and people think it's silly going on TikTok and everything, but I can't even emphasize how many people we've educated that can appeal for themselves, that didn't know the back ends to insurance, that didn't know Medicare Disadvantage this whole time. They thought it was an advantage. And I just feel very honored that we have created this platform for people to listen to and kind of figure out what's going on. Because before I started working here, I thought copays went directly to the doctor.
No.
I was like, wow, a $70 copayment, hefty price. This doctor thinks a lot of himself. Doctors get 5% of your entire spend.
Healthcare spend.
And 5%. You want the rest? The rest of it? Insurance. It doesn't make sense.
Or PBMs. We also have some other interesting things going on. We're doing a direct contract. I sent a proposal yesterday. It took me 2.5 hours. So direct contract is where a third-party administrator or the actual employer has a direct contract with us for services, and we don't have to go through the insurance company, and we certainly don't have to go through the PBM. So that actually it's a win-win because we get paid for the work we do, and the employer gets to pay us directly and doesn't have all these added on nonsense administration fees or whatever else the insurance company and PBMs come up with.
And we're rebuilding the trust between patient and doctor because the doctor can make the medical decisions,
not the insurance company's pay-to-play list. So anyway, I'm super excited because I have 17 patients that I am trying to get on this direct contract. And the patients are like, we want to stay patients of Dr. Box. And I said, okay, well, let me see if I can work with these people.
And I hope this goes to show that when we stop accepting an insurance, you better believe we did not go down, or we went down fighting. We went down trying tooth and nail. trying to work with them. The last thing we want to do is leave people without care, but we also can't dig a grave to where we can't help everyone else.
Well, becomes a certain point in time that the insurance company is putting their profits in front of the patients. I know that, you know that, y'all know that. But when they underpay us so severely that it's in jeopardy of keeping our doors open. I've got 24
that
people.
You're paying them?
Right. We're paying them to care for their patients. That's what happened with HealthLink.
It's just
so
a
we
shame.
said bye to HealthLink.
It's just a shame. Also, shout out to Mark Cuban's Cost Plus Drugs. Still waiting on him to like retweet me or something.
Call me, Mark.
He retweeted her twice, but Alex Oshie, maybe I have better luck with you. But yeah, we'll keep you guys updated. We have a guest speaker coming Monday.
And we're going to Oklahoma City on Wednesday, Thursday, Friday.
We're snuggling.
We're not. She's in a hotel room with my colleague, Nilsa. But myself, Dr. Bach, and Claudia are going to Oklahoma City.
Maybe my boyfriend. No, I'm just kidding.
He can't go.
He's
Dr.
working.
Bach
maybe wants a friend.
No, he doesn't.
Tall people love each other.
No. He needs to work. Your boyfriend, we can do something over the weekend if you want to have the boyfriend time. But let's make sure that you guys are really in love both ways.
You'll see the ring Monday.
Oh my God. All right. That is all for today.
Thank you guys for listening. Again, we'll be back. If you guys have any questions that you want us to like directly answer, if you need Julie's help advocating, if you want our opinion on something, because we're hilarious, we can do that. Just send a message. My email's everything on there. You can also subscribe to our Spotify. We're on Apple, YouTube, anything you name it. I'm sure you can find us.
Bye. Fiddlesticks.